First of all, let me first say how excited we are. I always like to be a first. I'm not a scared one who likes to wait and see how it goes. I want to be a trailblazer. So today, we are trailblazing Jacqueline. But to whom much is given, much is expected. So I wish for those in the room, perhaps who don't know quite what this means, to really understand it's a big deal. It's the first time where it's sort of a government to government kind of thing, you know? Because usually you go through the national government and then you include the county in getting things done. But you've heard about the localization and I really am excited about that. But I can also tell you, I am pretty sure, Jacqueline, if we fail, this is the end of this. So we must win, right? So we must make it win. So I'm really excited, and then I see increased use of quality, county-led, county-owned, and county-managed health and social services. That means a lot. That means a lot. Because it also shows the localization that you're talking about actually in action. So let me again welcome you all here this morning to Nakuru County, and specifically to Sarova, Woodlands in Nakuru. And I appreciate the efforts by USAID and Deloitte to make this launch successful. The government of Kenya has set a priority, which is the strengthening of primary health care, PHC, as the necessary strategy towards the achievement of universal health care and access to quality health care for all of us as envisioned in the Constitution of Kenya 2010. Top on HE, the President's agenda is to attain UHC. And I can tell you that Nakuru, we shall not be left behind. We are going to be that pillar that works very hard at the county level to make that national goal achievable. So we are thankful to our partners for helping us walk that journey. So health is a devolved function, as you all know, and consequently, the programs that will drive Kenya towards the achievement of UHC are domiciled in the counties. This is why the strategy of improving PHC as the route towards achievement of UHC is deeply embedded in my manifesto for Nakuru County as well. Provision of quality, affordable, and timely healthcare is a priority for Nakuru County. Nakuru County has demonstrated its commitment to provision of better health services through allocation of resources to the health sector over time. Because we don't also want to just talk about it, we want to put our money where our mouth is, yeah? So the total allocation towards health services in absolute numbers has been progressively increasing from 6 billion in the financial year 17-18 to 6.2 billion financial year 18-19 to 6.7 billion in financial year 19-20 and to the current financial year where we have 6.8 billion. So we are walking the talk. It is for this reason that we are keen to review and strengthen the provision of reproductive health, maternal health, malnutrition in Nakuru County. We want our mothers, our youths, and young children to get better services in our health facilities across the county. That objective cannot be attained without the support of partners such as USAID through this project dubbed as USAID Tujenge Jamii. I'm gratified that under the USAID Tujenge Jamii project, USAID is financing Nakuru County to the tune of 44,093,000 with a view to creating a county-owned, county-led, and county-managed integrated platform for better delivery of HIV, reproductive, maternal, newborn, child, and adolescent health. I always tell my people, I never see as many acronyms as I come across in health. It's a mouthful and it is RMNCAH. So we better know our alphabets, yeah? Water, sanitation, and hygiene, which they call WASH, and nutrition services. So this project commences on the 1st of July 2023 and covers the period through to 30th June 2024. And as we said, and as we're promising our partners here today, we are going to make sure, I know it's not easy, it can't be easy, otherwise everybody would have it, yeah? So we are going to do everything that needs to be done. I'm going to push them really hard so that even the year after, we are able to continue with the program based on how well we shall do this year, this coming financial year. So I'm humbled that USAID has designated Nakuru as a prosper county. The decision to designate Nakuru in that status, I can proudly state, is based on the county's high economic potential, effective governance practices, and commitment to creating an enabling business environment. It is my understanding that the USAID views partnership with prosper counties as an important opportunity to advance the journey to self-reliance in delivery of HIV, reproductive, maternal, newborn, child, and adolescent health, water, sanitation, and hygiene, as well as in nutrition services. More importantly, the first, can I say this out loud? The first and only county to benefit. However, on trial basis, for the government-to-government sub award. And I say that with all seriousness, we don't take it lightly. We know there is 47 counties in this country. It could have been any other county, and that is why I say we take it with a lot of seriousness and we must deliver. Yeah, and follow the rules. The USAID Tujenge Jamii project will be implemented in all the 11 sub-counties in selected health facilities. The key objective of the project is to increase county and sub-county level leadership, participation, and ownership for the achievement of TB, HIV, reproductive, maternal, newborn, child, and adolescent health, in addition to nutrition and WASH indicators, and for the implementation of TB, HIV, FP, nutrition, and WASH activities across, I hope by now you're following with the acronyms, yeah? Across all the 11 sub-counties, which is Kuresoi North, Kuresoi South, Nakuru East, Nakuru West, Nakuru North, which is Bahati, Subukia, Gilgil, Njoro, Naivasha, Molo, and Rongai. This will be supported through a series of cross-cutting and systems strengthening interventions that support the four overarching strategies thrust of the USAID Tujenge Jamii. Through this project, we expect to have a well-functioning health system working in harmony, which will be dependent on well-trained, adequately remunerated, and deployed, motivated, and a deployed and motivated health workforce, a well-maintained infrastructure, and a reliable supply of medicines and technologies, backed by adequate funding, strong leadership, responsive health plans, and evidence-based policies. While USAID Tujenge Jamii has supported the Nakuru County to strengthen those critical health systems and capacities over the course of the project implementation, interventions are needed by the Department of Health to ensure that these systems are fully operationalized to promote access to quality of HIV, reproductive, maternal, newborn, child, and adolescent health, FP, nutrition, and WASH interventions across all the 11 sub-counties. Ultimately, Nakuru County will have increased its capacity to plan, finance, implement, and monitor solutions to improve access to quality HIV, reproductive, maternal, newborn, child, and adolescent health. Nutrition and WASH, which was what? What was WASH? Majority leader, what is WASH? Huh? Why you are a doctor, so you are not the right one to pick. So I'm making sure that's sinking, yeah? Interventions across all our constituencies. The Department of Health will promote the culture of community participation, which is really important. It's really critical in the success of this project. In their own health through engagement with CBOs or community social workers or private, problem with notes, sector, who participate in health budgeting, financing, health promotion, management and monitoring of health services at county, sub-county, at sub-county and ward level to improve transparency, which is really critical, accountability and responsiveness. At least one CBO or private sector per sub-county will be involved. In conclusion, I want to thank the USAID, Deloitte, and all our partners for the designation bestowed on Nakuru as a Prosper County and its choice as the beneficiary of the SAB award. I'm confident that once successfully implemented, we would have found a solution to the delivery of quality of HIV, reproductive, maternal, newborn, child, and adolescent health, FP, nutrition, and wash services in Nakuru County. So we are extremely, extremely excited, and I am ready to put that signature on paper and make this a reality. So thank you all so much.